The opinions expressed by the 1.5 doctors on this podcast are for entertainment purposes only. They are not meant to treat or diagnose. If you have a serious condition, seek medical attention immediately.
No. There's been a mistake, you see.
Excuse me, what Dr. Lee is trying to say is that we need to sedate the patient or he could go into cardiac arrest.
All right, I'll get the anesthesiologist.
Hang on a second, nurse. What we should probably use is marijuana. That'll sufficiently sedate the patient for surgery.
Marijuana? But why?
We don't have time for questions. We need marijuana now, as much of it as possible. Like a big bag of it.
But doctor, we don't have marijuana in this hospital.
Shit.
Dr. Stephen Ogden, Dr. VJ Pure. Clinical Muscle starts now.
The doctors are in. You are listening to Clinical Muscle Radio on Advices Radio Network. I am your host, Dr. VJ Puri. Along with me, as always, is the star of this production, Dr. Stephen Ogden. Doc, how you doing?
I'm good. I'm good now. We have some technical difficulties this morning. I think the podcast gods are trying to tell us something.
Yeah, they said fucking retire. You're done.
Exactly. Why are you trying to do this? I do it for the masses. The masses called, so we have to do it. But this is crazy. It's never happened. We actually had a really bad rainstorm last night. We actually had tornado warnings in Delaware. It never happens. By the way, if anyone can hear the barking of a dog, I'm on the third floor of a townhouse, and that's my asshole barking at the front door all the way downstairs. Which
that's okay. Mine just came running out of the bedroom too and making all kinds of ruckus. So I quickly muted the microphone. I'm a whiz with that now.
I can't wait to be out of this townhouse. We have 4 more days. 3 more nights, 4 more days till we make settlement and move in our new house.
That's amazing. That's a good time right there. You know,
this has been the longest fucking process. It's affected everything. Now, and one of the things that's driving me crazy is the dogs don't have a place to run. You know, we have to take them out, walk them. And the reason why she's barking right now is because this house has a front door that has 2 side pane windows on it, and they can see everything that walks by the front of the house. And it's just constant barking. I
know how it is. We have the same thing. We have one side window. My wife tried to cover it up the best she can, but they can see it. They can hear it. You know.
Yeah. They can sense it. They're always got their faces in these little windows looking out front, and they just bark at anything that walks by.
Yeah.
And if it happens to be a person with a dog, it's just off the hook. So Bexy's down there right now, I'm sure, going nuts at the front door. I can hear her. So anyway, what's been new, man? What's going on? It's been a while.
Holy shit, it has been a while, man. You know what? Life gets a hold of you and just takes control. But you know what? It's like life is pretty important. You know what I mean? It's the stuff that we do outside of Podcastville is that's how we make our bread. You know what I mean? That's the main concern in life. You know, and sometimes that gets a hold of you and shit. You know, like just like with you, man. You're just like a matter of. You know, it's family stuff. It's getting your ducks in a row so that you can move into your new place and finally fucking be comfortable after 8-9 months. You know?
Oh my God, it feels like it's been forever. And that's the thing is like every time I think about recording, something always comes to fuck up. I'm like, we got this and I got that, and then with the kids, Haley's is back in lacrosse and she's playing games. She has a game tonight. I can't wait. A good 6:15, but it's just been really busy and to be honest, in this townhouse too, there's no real good place for me to record. So, you know what? I feel like I'm sitting in a closet trying to, record a show, and then I'm squeezing in the basement, and then now I got no furniture again. So I started off this morning sitting at this last piece of furniture. We have a dining room table, and then we had some technical difficulties, and now I'm up in Stevie's bedroom. And I got the door shut, sitting in his bed. So I'm like totally winging all this. But it's all good, man. We had to do it because number one, we have some questions. Number two, we text all day long, but
this is catch up time.
We don't hear each other's voices.
Yeah, this is catch up time. This is like you like talking to your friend for an hour and a half or so. You know.
Yeah, that's what I told Christine this morning.
One of my only 2 friends that I talk to, actual human beings that I like. Well, and that circle gets smaller every day.
Listen, it's funny. You and Scott, I talked to you and Scott, and then Christine.
Yeah, exactly. Yeah.
So yeah, when our last recording was when I was still fucked up from my hospital visit. You know,
Man,
I was sick, but I'm all back on the mend now.
A lot of nice messages from listeners, man. A lot of people concerned about you, and it was nice. It was nice to hear that people actually listen to this thing. You know.
Yeah, I'm still getting people saying, "Glad you're better, bro." You know, like, you know, don't die, doc.
So, doc, are you better now? Things like getting stable. What are you doing with your diet to make sure that this kind of shit doesn't happen again?
Basically, what I've done, which I don't know if it's good or bad, but I basically have just. I went back to eating some vegetables, but I'm just going to stay away from the really gassy ones. And honestly, I'm doing canned green beans. I know they're not.
That's perfect. I was about to tell you, just stick with some like the canned easy stuff on your guts, like the canned green beans. I mean, and anyone can process green beans.
That's what he he told me I can do. And basically, I'm eating regular food now. I mean, I'm basically doing. Same old stuff: sweet potatoes, rice.
You try cauliflower at all?
Say it again.
Have you tried cauliflower at all?
No, like I'm worried about that. Like he don't want me. By the way, he doesn't want my GI doctor doesn't want me eating broccoli ever again.
I can understand that. He told me cruciferous and
no raw vegetables. Like don't be the guy eating the vegetable tray at the party. He doesn't want me eating raw vegetables. I've been eating a lot more asparagus, the tips, because you can get them real soft.
Yeah.
But yeah, so basically I'm back to normal. I mean. I'm still like nervous about like my fiber intake. I haven't really been tracking it, but I'm sure it's still pretty low because started eating some canned green beans, and if you look at the back of the panel of them, the fiber is gone. They're devoid. They're pretty much devoid of fiber because of the way they prepare them. But other than that, I feel good. I mean, other than I'm a fat slob, but other than that, I'm good. Training's been good. I've been getting some good pumps in the gym. I told you about that video.
Yes.
The video. So I was doing some cardio. Oh, by the way, cardio has sucked too.
Why?
Because they broke our treadmill coming over from the other house. And I've been having to ride a bike and do an elliptical. Yeah. And I can't lie. I fucking hate both those machines.
Walking so much easier. Isn't it?
Like I fucking hate riding that bike, man. But I'm just glad I have it though because I have a bike and an elliptical, so
you can still get it done.
The funny thing, what I do with them is because I just can't I can't do 35, 30 minutes, 40 minutes in one spot on the bike. So what I do with them is I break it up. I'll do like 10, 10, 10. 10 on both. But so I was doing cardio one morning and I was clicking through. Some stuff, and Jay Cutler's, I love his YouTube. I don't know why I love that guy. He's a cool dude. I watch a lot of his stuff, and him and Matt Porter were working out together, and they had a video, and Matt basically wanted to start doing this workout, and he was training with Jay, and Jay's like, this isn't what I usually do, but I'll do it. And basically what they did, and it's kind of like I told you about it, so you've been trying to do a similar thing.
I love it,
dude. Basically, they were doing shoulders. So they did on the lateral on a machine lateral raise. They did first set. They just did right off the bat warm up. It was a warm up first set, 100 reps, and I'm sure they had 30, 20 pounds on there. And so I was like, damn. And then what they did was obviously rest it, minute, whatever, and then they went to, a heavy weight that they could do for 10 reps or or so, and they did a triple drop set, and that's the end. That's the end of that exercise. 100 reps, rest, triple drop set, boom, on to the next exercise. And they did 4 exercises like that. And I'm like, that looks fun. I want it because they were getting their pumps. Jay was like, their pumps are crazy. So I said, you know what? I'm going to switch it up. I want to try that. Well, I tried it. And man, I started off with the same thing. And dude, after that first set, I feel like I could have left the fucking gym. But I honestly, I had to admit, there's some goddamn grown men, them too, because I couldn't. I don't know if I picked too heavy a weight. I couldn't make no 100 reps, and I think I used 15-pound dumbbells to do my lateral raises. I think I got to around 60-ish. My fucking heart.
Man.
I've been doing it for upper body ever since then. I've done it with chest. I've done it with back. I haven't tried it with legs, and I'm probably not going to because I don't think I can do 100 reps of anything on legs. But I fucking love it. I love it.
Yeah, it's great. It's efficient and it works great. And you know what? No joint pain.
No, it gets everything warmed up, and you got a great pump, and you can jump right into that heavy set, and boom, and that's done. And I did it chest 2 days ago now because I had to work last night, and my shit is so sore. And I started off with this is the way he set it up. You start off with like something like flies or an accessory movement. You know what I mean? And you just get all the blood in there, and then you go to a heavier. Dude, I did cable flies for chest. Started off, boom. I did as many reps as I could. I tried to get to 100, and I know I didn't make it. And my shit was burning. So the next exercise I did was flat dumbbells,
Yeah.
Started off, did the same thing. I think I had 30-pound dumbbells. And then I went up, and as heavy as I could go was 75, and I barely got 8, and then I did a triple drop set. That shit is no joke. I don't think it's something you can sustain forever, but for like a good 4-week rotation, something that, it just kind of like got me happy to go to the gym again. Like it's fun.
Yeah.
I can't wait to go do it today again.
Yeah, same thing, man. I've been doing something similar, something similar to that, to what you've been doing. I like giant sets. I'm a big fan of giant sets.
I like that too.
So what I've been doing is I'll take a little super crazy lightweight. I'll pick like 4 exercises and just do a fucking circuit. You know what I mean? But each exercise I'm doing 30 reps. And so it's like 30 reps, 30 reps, 30 reps, 30 reps. And I'll make that, I'll pick 4, like all basic compound lifts, all of them.
Right.
I'll do like today's is chest day. I'll do flat dumbbell, incline dumbbell, incline barbell, and then flat barbell. So I'll do those 4. So it's basically all 4 pressing movements, different angles, different, contractility. And 30 reps, 30 reps, 30 reps. I'm using like fucking no weight at all. I'm using like the bar,
Yeah.
And just after the first circuit, my shit is all pumped up. I'm ready to rock. And I'll do that like I'll take 3-4 minutes, do it again. 3-4 minutes, do it again. And then I jump up in weight to whatever I can handle for like 8 to 10.
Right.
For each exercise station.
Exercise.
And after that, I'm fucking done. I'm done. There's nothing more for me to do.
No,
a lot of people. It's if there's one thing I could have told myself, if I could like transport myself, 25 years back, I would have said, I would have told myself, once you've reached a maximum pump, just a phenomenal pump, you're done. You're done. There's no reason for another hour to stay in the gym. Get out of there. Go do cardio. Just be finished, because the wear and tear that comes, you reach a point of diminishing returns. Once you get to that stage where you're maximally pumped, it doesn't get any more pumped than that. So what are you doing? All you're doing is further degradation of muscle cells and protein synthesis. You're dropping protein synthesis. Not good, right? You want to get that healing right away. So once you reach that pump stage, forget about it. Go do cardio. Done. That's the one thing I would say, because that's when the injuries start happening. That's when the chronic injuries start to develop. Is once you reach past that pump stage.
Yeah, because your muscles get over fatigued, and what starts happening? You start using joints and tendons and ligaments to lift the weight.
Exactly. That's what tendonitis. That's where tendonitis comes from. Overuse, chronic injuries. So yeah, that's the one piece of advice I would give to myself 25 years ago. But
you know what?
It's the one thing I'm making sure I do now to just for longevity. Is
lots of growth hormone. No, I'm just kidding.
Yeah. 30 IUs a week.
No, I'm just kidding. Yeah, what were you going to say?
No, that's the one thing I would do. Like, one thing I have been doing, regardless of whatever rep scheme I'm doing, is that once I reach a maximum pump, I don't care what else I had planned that workout, I'm done. You know what I mean?
I wish. This is funny. I think we have a question about something similar, like what have we learned and whatever.
Oh, no shit. Well,
I'm the
same. Answer that.
I feel like first of all, a couple things. I feel like when you're early on, you obviously, when you're young and you got that high testosterone and you're 16, which I don't think I ever had high testosterone because that's why I was so fat. But anyway, most normal guys, not girly guys like me, you want to try to lift the heaviest you can go. And, of course, I was always victim to that, and everybody is. And then, you don't really develop any mind-muscle connection doing that shit. And then, so for me, the one thing I think that I've gotten, over the years, like, and that's the reason why I think my workouts can be intense and brief, is because I have a great connection with just about all my body parts. The one that I struggle with was biceps. And I would say within the last 6 months, I've been really focusing on them. And what I found recently exercises that work for me. and I can feel it. I'm getting great pumps in my biceps. I think they might be growing finally. And I think that's the key with like sort of a workout strategy that, you know, a system like what we're doing now just for a little while, sort of the high reps, you go right to your heaviest weight, do a drop set, boom, you're on the next one. You have to be able to, you have to have the experience and to be able to connect with the muscle. So you're not only, you know, you're getting that pump efficiently with that short of time of intensity. Because if I did that with Stevie, right, my son, he would do them 100 reps and he wouldn't feel anything.
You get nothing out of it. He'd probably get like a faster heartbeat, and that's it.
Yeah, it would be cardio.
Yeah.
And if I took him to a triple drop set, it would just be trying to push the weight. He wouldn't be able to. So that's why I think at our experience, this kind of thing is so fun and good, because you're like, I can get this shit done in 35, 40 minutes and I'm going to be sore as fuck tomorrow. But if you did that to someone who wasn't experienced, they would be like, felt like they just ran on a treadmill, like maybe, you know what I'm saying?
Oh, absolutely.
So
yeah, no, this is a very advanced type thing. Like you've got to be able to, like you said, you got to be able to contract those muscles without a thought at the very first rep. You know what I mean?
And if there's one thing I see around the gym the most with people that I observe, it's that I can tell they're doing things and I'm like, they don't even feel that. I can just tell they don't feel it. I can tell the way they're moving it. I can tell the way their body is, you know, their motions. I'm like, they don't even feel that. And then I'll see a kid standing next to me trying to curl a 50-pound dumbbell, right? And I'm standing next to him. I'm obviously twice or three times his size, right? And I got a 20 in my hand, and I got veins popping out of my fucking shit because I'm squeezing the fuck out of it. Sure. And he's probably looking at me. He's probably feeling proud of himself, like, look, I'm much stronger than this big guy or whatever.
Yeah, I'm going to turn pro. This is amazing.
And the fact of the matter is you're doing nothing. And I think that's the one thing I learned too. That what you were just saying was, I wish I knew how to do that when I was like, 19 years old. I wish I knew how to make that. Like, I wish I wasn't so everyone like the ego thing. I wish I just went in there and let's say do hamstring curls and you're fucking squeezing that shit and holding it till you fucking can't hold it, and when you're burning, and you're doing that with, I don't know, 50 pounds on the machine, and you get up and you can't even stand because you've done that so efficiently.
Right.
As opposed to putting the big stack on there and you're swinging your head up, you're pulling it up, which is what I see people do.
Yeah.
So for me, I think that's the biggest thing. And a workout like this, it requires that, or else you're really going to you might not get much out of it. Like,
no, you could potentially get zero out of it, just a cardio workout.
You got to really focus. So even with and I think that's for me, that's always been the thing. Now I look back on, I probably wasted so much time in the gym doing been in there 2 hours with my friends doing 4 to 12, and then doing all the way up to where you could only do one rep on the thing, and and then you can't do a rep because you got to have someone pull it off you. And
I will say this though, in hindsight, that those 3-hour workouts, at least they taught you how to contract the muscles. Maybe it took that long for you to learn, you know what I mean? To actually learn the correct form, the correct postures for your body, your own biomechanics. And, so in hindsight, maybe those 3-hour workouts were necessary because they were a learning experience. Unfortunately, a learning experience, that's not going to always accumulate into hypertrophy. It's not going to accumulate to muscular gains. If they will, if you got pretty good genetics,
Yeah, not me.
Well, most people when they're first starting out, no, unfortunately, you don't even know it, until like a year later,
Yep. Yeah. So that's the big thing I think for me is just knowing how to connect, and then you can actually get your workout real efficient, and you do. I think to myself all the time, I'm looking around like I'll go in there and do my whole workout, even not when I'm doing this little routine I'm doing for fun for a few weeks, and I'll be done, and I'll look over and there's a dude still doing shoulder presses. I just did a whole fucking workout, and I'm like,
yeah. So Doc, how like on your chest day for this rep scheme that you do in the Jay Cutler, Matt Porter thing here, how long does like a chest workout take?
40 minutes.
Yeah. Okay, good. I was just trying to ballpark it for me too. It's roughly 45 minutes.
If that. I mean, I probably could be, but probably like 40 minutes, and then I'll throw in some arms at the end, 15, 20 minutes, and that's it. So it's like you're done. And then the next day I wake up and I'm like, all right, this is my first indicator was, and I know this isn't a great way, but I was like, am I going to feel anything tomorrow? And I woke up the first time I did it, my shoulders were like weak. And then when I did the chest, I was like, God damn, that shit really works. And it's fun. So like I couldn't wait to go do it again.
Yeah. I'm excited. This is the second week now I've been doing it and fucking loving it. I'm loving it.
Yeah,
you know what you do for legs, Doc? Because 100 rep squats is fucking impossible. It just
yeah. Well, I don't squat. So
it doesn't unless you're Tom Platz. It's not going to work for you. Your lungs will fail you, and you'll have a fucking a heart attack at rep 25, 26.
Hey, I don't want to have a heart attack.
So here's what you do. I've learned this. So you pick the compounds, right? You pick the compounds you want, like squats, front squats, a leg press, a hamstring curl or something, or stiff leg deadlifts. All right, those are your three lifts.
Yep.
But first, before, like, you pre-fatigue by using the bike, and I'm talking the bike. Do like a 15-second sprint, right? 15-second sprint, 2 minutes, just coasting, and then another 15-second sprint, and then go and do all your three basic compounds. You're not going to get 100 reps, no fucking way. But you'll already be in a physical environment, like your muscles will already be in an environment of close to failure. So whatever you can get, if it's 10 reps on each station, that's still an extra 40 reps. You know what I mean? So altogether, you will have done roughly the same thing without without your heart falling out your ass.
Right. Yeah. What's funny is I know exactly what you mean though. The bike, like that's what I have to use for cardio now. Mm-hmm. And sometimes I'll turn the intensity way up and I'll have to pedal that bitch as hard and fast as I can just to see, dude. And you can get a quad pump doing that. Like I got veins coming out.
Unbelievable.
In my quad. Yeah, that's crazy. You get up and by the time you do that for 10, 20 minutes, you get up and my shit is like shaking.
Yeah. Oh yeah.
You get the bike's no joke if you want it to be, or you could sit there and usually I just pedal like a pussy. But I mean,
me too.
Yeah. I put lots of layers on to make myself sweat because I don't want to have to make my heart rate work. You don't have to go up too high.
Yeah. I hear you.
Oh, speaking of heart rate, this is a medical thing for me. Is since my hospital visit, when I was this is crazy, and I don't know if something tripped or something went wrong, but this is going to blow your mind. And I was like, whoo. So when I went to the ER, and maybe I rehashed this, I got in there and they checked my blood pressure. Did I tell you about this already?
No, I didn't hear anything about blood pressure.
And I was like, holy shit, dude. And of course I was in pain. I had a bowel obstruction, all this. And my blood pressure was 180 over 110.
Wow.
I was like,
what the fuck?
That's what I said. So, you know what? I was like, you know what? That freaked me out. I calmed down. But long story short, I've been monitoring my blood pressure and I've never had it really high. And then so the whole time I was in the hospital, it was running like 150 over like 90. And I actually lost weight, right? So you would think that it would have went down. And, from losing weight, even though I'm back to what I was now. Long story short is I've been monitoring it really close, and my blood pressure was running ever since I got out of the hospital. It's been running like 140 over 90 something. It never went down. So I'm kind of like, what the fuck? I hope something didn't happen. But so I actually had to get a doctor's appointment in air quotes, and I started lisinopril, and my blood pressure from the second day I took it was like 118, and it's been like that the whole time.
Wow.
So I'm kind of like, did something happen to me when I was in there besides that? Because so. I don't know if it's stress. Or
I don't know. I mean, geez, man, I don't know what the fuck other than stress. What else could it be?
I don't want to think about it. I don't know. Did something happen to my kidneys or my heart? I mean, my numbers were all good when I was in the hospital. You know what I mean? I haven't got any labs since I left, but so I didn't fuck around with that. I went and got my doctor, quote air quotes, to put me on some lisinopril, and I'll tell you, I've been talking about ACE inhibitors probably since we start the show, and ARBs too, because I consider them one and the same if you're going to use them. I mean, they basically do the same stuff. Of course, telmisartan is the one that may have some other properties. We all know that. People don't need to rehash that. That's on every podcast. Everybody wants to talk about that. So, and So I got started on 5 milligrams of lisinopril, and boom, it's like perfect.
Yeah. Wow.
And so it just proved to me what I've been doing to other people for years, is that ACE inhibitors are good medicine. I haven't had any side effects. I don't even know I'm taking it. And it's only 5 milligrams, and my blood pressure's been perfect. Now so I was like a 130s guy all the time, you know?
Yeah.
A 130 over 80. And to me, you know what, by the new guidelines, that's actually considered stage 1 hypertension. But I've been like that my whole life. So I always consider that still normal for people. If your blood pressure is 130 over something, 80, you're not going to die. Kidney or anything. So that's pretty. I mean, I find it hard in my job to find someone with a blood pressure that's less than 120 over 80. Everyone comes in, their blood pressure's high, but that's beside the point. So even though I've been like, that's been a drug I've used for many years on many people. I've seen it work.
Yeah, they work. They work good.
If I was going to get put on a medicine, that's the one I wanted to be put on, and it worked. So I'm a believer, and now I'm like, should I try to stop this soon? Maybe it was fluid, maybe it was stress. I'm thinking, you know what, fuck it, I'm just going to stay on it because my blood pressure's never been this good.
Yeah.
I'm like super low. I checked it at work one night, it was like 105.
Dang, it's a good number. Jeez.
Yeah. I mean, it's a good number unless you're feeling lightheaded and dizzy, but I wasn't.
Right.
I told Christine, I was like, dude, that shit works. Like, and she's like, well, you might as well just stay on it, because we both were kind of like, you know what, we've been stressed out. You were sick. It's only been maybe a month. I don't even know if it's been a month. Yeah, I guess it's been a month since I've been out. But I'm like, fuck it now. So I'm just going to stay on it.
You're still able to get pretty good pumps with using lisinopril?
Haven't noticed any difference.
No difference. Oh wow.
Yeah, no. And with this new little routine I'm doing for a few months, a month or whatever, they've been crazy good. So no, I haven't noticed a difference. But
dude, I get flat as fuck on ACE inhibitors, and not even like 5 milligrams. That's all it takes. No pump. I'll get no pump. It's crazy.
Well, what I've been doing, and I don't know if there's science to back me up, but this is my thought process. I haven't been taking it before I train. Like, I've been making sure I take it after I train.
Maybe that's the thing.
I don't know if that means. I don't know if that makes any difference at all. Like, I don't know. But what you're talking about, I actually thought of you when I started the medicine.
You're like, oh no, I don't want to take this, and I'm going to pump. It fucking blows.
I knew you said that, you felt flat on it. You felt you couldn't pumps on it. And so my thought was, I don't want that to happen. So, and I don't know if it matters, because technically the medicine's in your system for 24 hours, right? Mm-hmm. We know it probably doesn't last the whole 24 hours. I've seen that, because I know if you stop taking it by the next morning, sometimes your blood pressure will be rising.
Now, is it elimination time of 24 hours, or is it a half-life of 24 hours?
I can't answer that. I'm not sure half-life unless I looked it up. I'm not going to lie. But think about it. It's a once-a-day drug, right?
Yeah.
So technically it should be lasting the whole 24 hours. Because if it was a 12-hour, we would tell you to take it BID.
Gotcha.
Yeah. So long story short is, I thought of you when I did that. So I've been taking it. I've been taking it either at night or post-workout. And my reason for post-workout is sort of rest and digest, kind of like.
Oh, yeah.
Let everything sort of settle down, get your blood pressure down, get your heart rate down, let everything kind of get back to normal. It doesn't affect heart rate, but in general, you know what I'm saying? Lisinopril doesn't affect heart rate. It just affects blood pressure.
Right.
But I thought about you, so I haven't been taking it before training. I make sure I either take it after I'm training, when I get back from the gym, or at bedtime. That's what I take.
That's a good plan, man. A lot of the times when I take my metformin, it's always post training sometime, because if I take it in the morning, boy, getting a pump is really, really a struggle.
So so that's an update on me, and I'm like, I when it wasn't going down, I didn't want to be a hypocrite, because if someone wrote into us on the show and was telling me that exact scenario, and their blood pressure was still running 140 or 150 and is staying like that for 2 weeks, I'd be like, you probably want to talk to somebody about that. Mm-hmm. And medical people we're the worst. We're the worst patients, right? I mean, we ignore ourselves. I'm probably the worst, because I'm one of them people that I was always a little bit of a hypochondriac anyway. And now I know too much. So like, I'm like, if I get my blood work done, it's always like so much anxiety, because I'm just waiting to look and go, yep, I got cancer. I knew I I was going to diagnose myself. Renal failure. I knew it. I knew it was going to happen eventually.
Worst case scenario first.
I had to refer myself to a kidney doctor. Anyway, so yeah, it's been working great. So that's just a update on that. I don't know what happened, why it did that. I don't know if it's fluid. I don't know if it's stress, but you know what? I'm staying on it now because my blood pressure's never been so good.
Nice.
And I don't have side effects, I haven't. Like I said before, the ACE inhibitors are really safe, in general, they're pretty, and I know there's been some other stuff out there recently about them. It's some negative stuff, but fact of the matter is they've been around a long time and have helped a lot of people. And,
and you've only ever prescribed that about a million times.
Yeah, exactly. Right. And there's the other options for me were like, should I take a beta blocker? Well, I don't want limp dick. Mm-hmm. That's potential,
and you want to burn some fat at some point, right?
And that's the other thing. And right now I'm not too worried about that. But that was the other thing. I don't want to be doing my cardio that's already tough and it's harder for me because you can't get your heart rate up.
Yep.
I don't want to be tired all the time, which is a potential. I don't want to be depressed, which is a potential.
Yeah, man. I don't know. Beta blockers. Just horrible feedback on beta blockers altogether.
They're great drugs if you need them. I mean, if you have a rhythm disturbance, if you have like chronic palpitations, if you have, of course, heart failure. For heart failure, you're actually going to need both a beta blocker and an ACE inhibitor. They're actually considered life-saving drugs. But anyway,
dang. Yeah.
For I'm talking about
that's life and death shit though. That's
when your ejection fraction's low and all that stuff, but. But for a young guy who has hypertension, a white guy especially, now I know that sounds terrible, but it is a fact. There's some differences when you prescribe medicines because it can be some differences in blood pressure between us and an African-American guy, which is why there's also a difference in the GFR. If you look on your kidney panel, it'll say non-African-American, and it'll have a different number. So anyway, that's beside the point. But yeah, so lisinopril for me, man, is working great, and I think I'm just going to stay on. I'm not even going to risk it. I don't know what happened. I hope I didn't have a fucking heart attack or something, like a mini heart attack in an
Yeah, that's no good.
But so yeah, man, it's like kind of weird, but I feel good now, so I'm good.
Jeez, well, fuck, keep an eye on that, huh?
Yeah, I've been checking all the time. It's never been so good, so I'm kind of like, fuck, maybe I needed that earlier.
Yeah, shit. Mm-hmm. Well, Doc, what do you say we attack some of these questions over here on the Advices forum?
Let's do it.
So you go to forum.advicesradio.com, click on the bodybuilding discussion link, and that'll take you to all the shows. It'll take you to Blood, Sweat, and Gear, Drugs and Stuff, Muscle Minds, Clinical Muscle, all the shows that Advices puts out, and you can post anonymously. I still get, on the occasion, I still get a few Instagram questions here and there, but this is the best way. This is the only way that for sure we're going to answer them. So let's go to the first question here from the boards. Hi, docs. Just a question about some blood work and how to interpret it. 2 weeks into my cruise, I went and got it's cruise as in the steroid cruise, not his cruise to Bahamas. 2 weeks into my cruise, I went and got some blood work done, and it recently came back with the results. I was very happy and shocked with the results from the blood work since I ended my blast with a few orals. However, my question is regarding blood count. I will attach the results for my blood count values below, and he attached those. Thank you very much. This was the only marker that was my concern because that shit can kill you if values are too high. The EVF being hematocrit at 0.52, range is typically 0.39 to 0.5. And hemoglobin being 179 grams per liter, which is 17.9 grams per deciliter. Since both hemoglobin and hematocrit are elevated, I will go ahead and donate blood in a few weeks, but my question is more for learning and understanding. How do detrimental / bad, how detrimental / bad are these values for someone coming off a blast with 1 gram total plus Winstrol and Aromacin? And from my understanding, hematocrit is the value of concern or the value you really want to have checked. Since hemoglobin is the protein inside of the red blood cells, which carries oxygen to all parts of the body, and hematocrit being the number of red blood cells in the blood, and therefore elevated levels of hematocrit cause more concern when it comes to risk of getting blood clot and stroke. Take a look and see what you think, guys. Thanks for the show. So I got open this up and I got to look at the values, and
They're from another.
This is not an American system, right?
Yeah, and you know what? For us, that's always tough because I know we got a lot of listeners. I don't know if we got a lot. Maybe 1 or 2 listeners from UK and other places, and I know that because people Instagram me and ask me questions too. But he did interpret it in our range, at least for the hemoglobin. So yeah, that makes it tough. But you can see, I just go like this. Look, one of the things I learned in my job is I just look at the normal range, and if it's abnormal, it's abnormal. If it's normal, it's normal. Mm-hmm. But he interpreted the hemoglobin of 17.9 for us, so that helps me a lot.
Mm-hmm. Yeah.
And so I imagine his hematocrit is, higher 50s, right? So, or high. So long story short, he's asking how. First question is how
how bad are these numbers for coming off a blast with this?
Honestly, I'm going to say this, and of course, we don't want our hemoglobin too high, but 17.9, you can find on some labs in our country that the top normal is like 18 on hemoglobin, which isn't great. But so I would say I've seen way worse than that, honestly.
Yeah,
so
that's not.
I mean, we're all different. I can't tell you you're not going to have a stroke or heart attack or something, but honestly, if I saw this and I knew the scenario, I'd be like, not so bad. And you know what? Maybe you do want to go give a little bit of blood, but honestly, I don't think you're at a whole lot of detriment of having a stroke or a heart attack today with that number. Like I said, there are some labs, and you can Google it and ask what the range is for hemoglobin, and you're going to find some will quote up to 18. So he's kind of right in that range still. And if he got donated one time, it'll probably take him down around 16, I'd say, or so. And then he'd be pretty safe. So in your number right now, I would say, yeah, go give blood. But you know what? Don't be paranoid as you're walking around and you're about to have a stroke right now. Mm-hmm. I mean, we have people living at altitudes who probably have 1920s hemoglobin, right? People in Colorado, they adapt to that. And I don't know if there's a big difference between, and I obviously I'm not a big study guy, right? I mean, I'm sure there may be something out there like this, but I don't know if there's a big difference between your hematocrit and hemoglobin being elevated from whatever cause, even if it's testosterone or some other cause, versus living on a mountain and eventually it goes up to 1920. I mean, it's still there, still in your body. So I sometimes think maybe we get a little overly crazy with that, but his number 17.9, I would say, is high, but wouldn't make me jump off the chart. In fact, God, I'm terrible. I may see that and be like, call and be like, hey, Bill, well, your hemoglobin is a little bit high this time. How about we recheck it in 3 months? Maybe you were a little dehydrated or something.
Yeah.
So,
yeah.
It's high, but it's not the worst I've ever seen.
And that could very well be the thing, Maybe he just wasn't hydrated enough, and now his values look skewed.
Mm-hmm. Yeah. So I mean, you never know. That's always a possibility. So don't freak out. Go give a little blood, and I think you'll be okay. And what was the other question? Oh, so here's the thing about hemoglobin and hematocrit. And what he wrote down here is technically all correct, about what they are. Mm-hmm. Meaning hemoglobin. That's the number one looks at. But you can't have a high hematocrit and a low hemoglobin.
Hey, Doc, can you re-explain that? You dropped off completely. You were saying the difference between hematocrit and hemoglobin.
Are you there?
Yep.
Okay, good. We had the damn technical difficulties.
Yeah, so, I know. I'm watching.
So he described sort of what he learned about what hemoglobin and hematocrit was, and what he wrote is right, Mm-hmm. But he basically wants to know which one of the two, hemoglobin or hematocrit, should he watch as far as danger, high levels. And the answer is both, because you can't get a hematocrit without a hemoglobin. Like,
correct.
You there?
Yeah. Yep.
Yeah. You can't order. Maybe you could, but the fact of the matter is from my standpoint, I've always been taught to trend. For instance, so in my job, when I'm dealing with blood counts, I'm usually looking at anemia, right? So what do we do when we're trying to find out if someone needs blood or they don't need blood? First thing they'll ask me, if someone just got shot, they'll say, check his hemoglobin. We'll do his hemoglobin. And if it's low, that's how we say, how many units of blood should we give him? Let's give him 2 units, bring it up to blah, blah, blah. And so either one is going to tell you if you're fucked up or not, because you're going to get them as a unit. You can't have a hematocrit that's 60 and a hemoglobin that's 8. It doesn't work that way.
Right.
So if your hemoglobin...
They elevate together. They have to.
And there's RBCs. in your differential, red blood cells, your red blood cells are going to be up, your hemoglobin is going to be up, your hematocrit's going to be up. So the answer is, whenever I check blood counts, I look at both, but they're both going to be elevated. So if someone has a hemoglobin of 20, you can bet your fucking bottom dollar the hematocrit's going to be 60 or something like that.
Yeah.
Right?
Yeah. Jeez.
So it doesn't matter. It's a trend, and either one can tell you if you need to do something about it.
Yeah.
I'm a hemoglobin guy. Why? Because that's what I've always used to give blood. And meaning when someone comes back and I get their CBC and their hemoglobin 6, I'm like, holy shit, they need at least 4 units of blood right now to get them up to about 10, right? So I don't go, oh, their hematocrit's only 20. I know it's fucking low. It's all low, right? So to me, it's both of them are worth trending. You're going to get the same result by looking at both. If your hemoglobin's 17.9, you know your hematocrit's going to be somewhat elevated too. Or vice versa, if you look at a hematocrit and it's 60, you know damn well you got a really high hemoglobin.
Doc, you were talking about giving the patient units of blood. How many grams per deciliter is 1 unit of blood?
Many grams. You can
estimate, like you said, someone comes in with like 6 grams per deciliter and they need blood.
If you give them a unit, you probably get it up about 2. Like
you get it up 2 grams per deciliter. Okay.
Yeah, that's why I said it. That's kind of I don't know if that's the exact. That's kind of the estimate I've always used. So I'd give them. And if I got them above 8, I always felt comfortable with that. You know, you're talking severe anemia when people are like really sick. So when they get above 8, you're like, whew, you can survive with that.
Jeez. Yeah.
But I've seen people with hemoglobins of 4.
Oh, wow.
Okay,
Jeez.
so let's take that person for instance. If
Yeah.
their hemoglobin is 4, do I need to ask what their hematocrit is?
Yeah, right.
Right? The hematocrit's going to be nothing.
This is going to be awful. Something pretty terrible.
So that's what I'm saying. Like, both are they go up together. You know, they're going to go down together, going to go up together. I've always been a hemoglobin guy. I don't know. It's just a number I look at, but both are fine. You know, just like when if you don't order a total CBC, we order what's called an H&H, a hemoglobin hematocrit, and you get both the numbers. So if your blood is thick, it's thick. Doesn't matter what number you're looking at least in my opinion.
Right.
You're going to see them both go up.
Yeah.
Yep.
Realistically, with this guy and his cruise and blast and 1 gram, these numbers pretty good.
I mean, that's what I'm saying. I mean, I always be careful. I don't want to say something and someone have a stroke because that's it's not. But like I said, if I opened up his CBC and saw this and I knew the scenario, I'd probably be like, doing pretty good compared.
It might be just a thing of go give some blood and get it rechecked in 4 weeks and see what it looks like. You know,
I have other questions to ask him. Like, what was the scenario when you got your blood done? Did you go at 5 a.m. and you hadn't drank for 13 hours? Because that can affect it. And I think on this, which I don't know when this show will come out, but on this week that I just listened to, Muscle Minds, Dr. Scott was kind of talking about this kind of stuff a little bit.
Oh, cool.
It's because Scott McNally was talking about his own blood work. And, they were talking about how long. We had a question about this. How long should you wait to get blood work done after you train? Dr. Scott went into detail about what things get elevated with training, what things what things will come down if you took a couple days off. But that's this week. And today is what? April 15th?
Yes. Yeah.
I don't know when our show will come out, but that was yesterday or the day before show.
Yeah, I saw that released. I'm going to start listening to it actually today, so that's good.
Yeah, it's a good show, and they talked about some other things, including some absorption, bowel stuff and absorption stuff, and cool. And that's when I sent you guys the text about my nephew.
Oh yeah.
They were talking about certain fats, and I don't want to give too much of the show away because this isn't Bodybuilding Nerds. That's what you guys do, of course. I am a nerd.
Of course. You're honorary. You're the third wheel,
But one thing they talked about was sort of absorption of fats and the difference between eating whole nuts and peanuts and eating peanut butter. How you can actually check that out. It's a great show. If you didn't know, you probably heard it. But long story short is this is a story that led me to think of something. My nephew he died at 24. He had cystic fibrosis. Part of cystic fibrosis, if anyone doesn't know, is is a lung disorder. It's genetic. He's born with it. But it also, because of the genes that are affected, affects anything that produces mucus. So think or secretion. So you can think of it, anything that produces anything, even sperm. So they're usually infertile because it's too thick. It can't, they have, the pancreas doesn't make correct enzymes because the mucus is affected. Gallbladder doesn't produce. So you get my drift. So he was supposed to take 20 with each meal, 20 pancreatic enzymes with each meal.
Wow. Yeah.
Of course, he didn't do that because he was a young kid and he's like, fuck that. I just want to eat. Yeah. And he had what we call steatorrhea. His stools were nothing but oil. He didn't absorb 1 ounce of fat.
Wow. Yeah.
His poop would literally, if you came in the bathroom after him and he forgot to flush or whatever, his stools would just be like an oil spill if you saw it in an ocean. You know what I'm saying?
Wow, man, that's
just floating. It was just nothing but liquid oil. He absorbed no fat if he didn't take. So, yeah, I don't know. That reminded, because they were talking about that kind of stuff. So anyway, check Muscle Minds out. But by the time our show comes out, I'm sure that'll be 6 episodes ago.
Yeah. Yeah. So with cystic fibrosis, the cum's going to be weird, right?
Yes, they don't have viable sperm in most cases because
there's no way. The sperm can't live in a mucus-free environment.
It's very thick and it just doesn't support the right. Yeah, so they generally are not all, but that can happen. And of course, he also had testicular cancer, and we don't know if that had anything to do. We think he just had a really bad, rough, unlucky life. So he had a testicle removed and he was 19, and long story. Anyway, he passed away at 20. So anyway, his poop was gross.
Yeah. Hey, speaking of poop, Doc, how's your poop doing?
My poop is great.
Is he like since your medical scare, things are moving pretty good?
I've been 100% back to normal. In fact, improved without eating so many vegetables. I mean, I've been less gassy, less bloated.
That's perfect. Those are the that's the biofeedback that you need.
Yeah, no, and so it's reassuring me, sort of reassuring me that, or reaffirming, or that maybe I was overdoing it with the. I mean, I ate so many vegetables. I can't even tell you.
You did. I remember your diet.
I mean, bags. I would eat bags. I didn't eat a cup. I ate the whole bag.
Yeah, jeez.
The steamer bag.
You thought you were being healthy all this time.
I'm just trying to fill up. You know what I mean?
Yeah. Oh man,
that's kidding me. See, I can even indulge on fucking broccoli. So,
did you end up getting a nice greens formula then, or?
I haven't done that yet. I'm a loser. Yeah. I don't know if I can stomach the taste of grass clippings.
Oh, dude, it's so bad. It really is. I tried to, and I just can't do it. I'm like, fuck this. I'm gonna stick with these fake vitamins and minerals instead to get what I need instead.
Hell yeah.
These green drinks suck balls. The ones that are good tasting, they're garbage. They don't do anything. I can see them fully formed in my own poo,
Exactly.
I'm like, this has done nothing for me. It just passed.
That's another thing Dr. Scott was talking about. I'm giving Muscle Minds all the way. So, yeah, he was talking about a little test of transit time,
Oh, that's funny. Oh,
like
good.
Me, I'll give you my test of transit time. When I put frozen blueberries in my oatmeal, guess what they come out as?
They come out whole? Like corn, right?
Yeah, like fucking I shit blueberries, like wrap.
You've got it's like a pile of deer poo when you're done.
I'm gonna make me piss myself. That's just facts, though. So that's a good test. Man. That means they move through my fucking system fast.
Yeah. You know what else moves through your system? At least my system fast is carrots. Not just me, my dogs too.
Really? No, I don't have a problem with that.
Dude, there were chunks of carrot. I picked up like 30 pounds of carrots from the yard yesterday.
What the fuck?
Yeah, and then I can see it in my own poo too. I'm like, I'm not any different.
Reindeer ain't hiding out there.
It's the most weird thing. Even in my own stools, man, carrots, chunks of it. I'm like, why is it so orange? Am I got cystic fibrosis or something?
Nope. Have cystic fibrosis.
Chunks of carrots.
You got a malabsorption syndrome. That's why you get flat from lisinopril.
It's probably. God knows.
Hey guys, Why are you using sports nutrition that was designed for someone else? At TrueNutrition.com, they offer the world's largest selection of quality protein powders, and they let you design your own custom blend from a variety of powders, flavors, boosts, and packaging options, like the Team Skip blend, for instance. That's over 20 billion possible combinations to create a protein powder tailored to your diet, your goals, your tastes, and your budget. TrueNutrition.com also offers the ability to create delicious custom oatmeal blends. And they're third-party tested, proving that all their supplements are ensured to have the highest level of quality and value. Don't be a sucker and pay for fancy packaging and gimmicks. Discover the source that bodybuilders trust and stop using mass-produced nutrition that wasn't designed for you. TrueNutrition.com. And use our code ADVICES at checkout to let them know that you support the shows. Hey guys, Scott McNally here.
And this is VJ Peary.
You guys know us from here at the Advices Radio Network. Well, we also have another show, Bodybuilding Nerds Radio. We've got everything from supplement reviews
to shout-outs,
listener questions,
and of course, our weekly bodybuilding podcast reviews.
So check us out every Friday.
Or whenever you feel like cooking or doing your cardio or basically wasting time with us.
You can hear us at bodybuildingnerds.com.
Also on iTunes. Bodybuilding Nerds, it's time to get nerdy.
Let's see here. Next question from the board. Mona Vand. I don't know who that is.
I have to, we go back up. I think there's one before that.
Is there one? Oh, gotcha. Here we are. Hey, guys. Glad you're feeling better. Doc sounded awful. He was. I'm curious what you guys think about injectable glutathione. I hear a lot of good things when I was thinking about trying it. I'm interested in its benefits concerning increased immune support and general longevity. What are your thoughts? What's the best protocol for usage, frequency, injections, dosages, etc.? It seems like it could be pretty pricey, dependent on protocol, so I want to get as much information as I can out of it. Love the show. Keep up the good work. Doc, do you have any experience with glutathione?
You know what? This is one of those questions where I honestly probably have as much knowledge as the question.
Yeah, I don't have much. I don't have much to add.
I think we all know what glutathione is, right? It's an antioxidant. It's one of the most powerful ones in our body. We produce it ourselves if you have a good diet, nutrition. It fights free radicals and prevents oxidative stress, which we know kills cells, destroys cells, makes cellular damage. So supplementing it if you were older or if you didn't have a good diet probably wouldn't be a bad thing. Obviously, a lot of people do it. I know a lot of the anti-aging clinics put it in their package. And I think it goes down. It's one of them things in my book that, first of all, I don't know. I'm not going to lie. I don't know a dosage and protocol. And I on this show, I can't really give that information. That would be like me prescribing a medicine. But
sure.
I haven't prescribed it or anything enough to where I could even, and I haven't even looked into it for personal, like if it would benefit me. I haven't really, because to me it comes down to one of those things that if it has, and it probably does have benefit, right? But there's a whole lot of other things I think I could do to keep me healthy. And he mentioned that it's pricey. So for me, it's one of those ones where we have foundations of stuff that we should do.
Yeah.
And then we have things on the fringe that may help, right? And if your pocket can afford that and you want to try it, my answer to this question is it may be beneficial. It may do nothing. And it may just cost you a lot of money. But if you can afford it, I don't think it would hurt you. I don't think it's harmful. I would not, this is just my education. Like I said, I've probably learned about as much about glutathione in the bodybuilding sense as this guy has. From my education and reading, if you're going to do it, the oral route's probably not the best route.
Correct.
It probably doesn't absorb very well. You're not going to get it bioavailability. But, from a doctor standpoint, I can't say I've ever prescribed someone glutathione. I haven't. But my point of this is that it's one of those things that I don't think it's going to hurt anyone. If you can afford it and you want to try it, then I would say go for it and see if you notice any difference. I know Dave Palumbo speaks highly of it. And I think he even said one time he thinks everybody should be taking it. I don't know about that.
I don't know. I don't know about that either. The truth of the matter is that if you have depleted sources or you're not producing enough, then you're a good candidate for it. But you don't know that until you actually get your own levels checked and you have a trend that you've developed and you can already track. I've had patients. Clients get on glutathione. I refer a lot of my clients who need hormone work done or blood work done to my own doctor out there in the Quad Cities. He'll do stuff all over the country. He'll do stuff all over the world. So to me, I can send all my clients over to him, refer them over, and I let him take care of like glutathione stuff. Because that's not necessarily anything that's going to help me diet somebody down. You know what I mean? It's not going to be a factor of like any metabolic issues or anything. But I have had clients use glutathione and all of a sudden their skin is clearer, their hair is longer, their hair is better, nails are better, their health is better, gut digestion's better, things like that. But I've also had clients who are like, using this stuff, I don't know, can't tell jack shit. And
I think that goes for a lot of the stuff we do in bodybuilding in general, especially with supplements. It's like some people might say this worked great for me. It did all those positive things you just said, and some people might say, I didn't. And as far as the immune support and longevity, and I mean, I don't know if you can objectively even.
No, there's no way.
You can't really say, now
it's so subjective. It's so subjective per person.
Yeah. So, like I said. I know it's a very powerful antioxidant. We know that's a good thing, right? We don't want all free radicals floating around and causing all kinds of issues in our system. So does it probably help? Could it help? Yeah. I mean, I guess it could. Is it worth it? I guess that's a personal choice. If you have the funds and you want to try it, I say go for it. It's not going to hurt you. As far as what I know of it, but I couldn't even tell you, take this is the amount I would prescribe because I'd never done it. And like I said, if you are going to do it, always make sure you talk to your doctor about it, because you probably don't want to do the oral route because from what I understand, it's really not doing much. That's just my reading. So
yeah. So next question from the board. I was starting with this one, Mona Vand. I don't know who that is, but I just read the rest of the question, so I have something to say at least. So Mona Vand had a red. I don't know what it something. Some article about.
No, I think she means she wrote something. I don't know who she is. She had a read. Yeah. I wonder. Okay. Honestly, maybe I don't know very smart people in the world, but I have no clue who Mona Vand is. But that's fine.
But anyways,
she probably doesn't know who Steve Ogden is either. Which
there's no way.
I guarantee she doesn't know that.
Anyways, this person Mona Vand had something to do with said something about intermediate fasting and how it can delay Alzheimer's and increase HGH. Is there any truth to this? I don't know who Mona Vand is, but I can tell you just from anecdotal experience and some medical literature that I've seen online, PubMed or whatever, Medscape, that intermediate fasting, yes, can delay Alzheimer's and yes, can increase HGH. Reason why I say this is because just I don't know. I think he meant intermittent fasting
I bet it was a typo. Like you know how it's probably autocorrect.
Yeah, he probably like talk texting, and it said intermediate instead of intermittent.
I took it as intermittent when you read it. So
yeah, we're gonna assume it's intermittent, and yes, intermittent fasting can delay Alzheimer's because look, all the literature is coming out Alzheimer's is because it's all dietary. A lot of it is, yes, there can be a congenital defect there. It could familial history where you're more susceptible to degradation of the white cells, in your brain or whatever. But a lot of that is mediated by your diet and your nutrition. Unfortunately, sugar is the worst thing that someone can do that can affect Alzheimer's. Just sugar intake alone can just destroy your white matter, gray matter for whatever reason. It's it's just one of the many toxic things that sugar can do. I don't know if it has to do with the depletion of dopamine and serotonin levels. I don't know what the science is, but the science is all pointing towards sugar being the number one cause for Alzheimer's. So if you are fasting throughout the day and you're giving your body in your digestive system all this rest, then yeah, that's going to immediately affect Alzheimer's and any other malady that comes with overeating or sugar intake or anything else. You know what I mean? And in the same vein, the longer you are without food, the higher your GH levels are naturally going to increase, because GH and insulin they have a like an opposite effect on each other. If insulin levels are high within the body, then your pituitary is not going to kick up HGH. Now, if your HGH is high in your body, the pancreas is not going to kick out insulin. It's a reverse relationship that your body has developed with its own homeostasis. So yeah, intermittent fasting will increase HGH because of your insulin levels. They're gone. You know what I mean?
Yeah, funny. Last night, I browsed the questions last night, and I was actually reading this question with my nurse practitioner, and I was kind of explaining why that would happen. And I agree, I don't have anything to add to that question. And even, well, maybe a little bit, but obviously there's, with the Alzheimer's thing, there's really some good stuff out there, and I've read some stuff about that. And there's always more studies we need type of thing. But but just think about what the comments you've heard. For me, this is just my anecdotal stuff, just from talking to people who do different diets and things like that. Some of the things I've heard people say when they do like intermittent fasting is things like, I feel more focused. Yeah. I feel more clear.
Yeah.
I feel more alert.
What does that tell you? I mean, what are all those positive things? It's having
a positive effect on your brain. Now, I'm not an intermittent fasting guy, not because I don't think it's cool and it's good and it works, because I'm a fat fuck and I like eating. And that's my problem. So that's what I say. And I've had I was actually talking about this with my nurse practitioner last night, this question, because her husband has been doing intermittent fasting, and he's lost like 18 pounds since he started it. And she said he says some of those things, like he feels more energy, he feels focused, he feels clear, he's not tired as much. So right there, that tells me there's something to that, because you read on the boards, Google, talk to friends, people who've tried this, you're going to hear those kind of comments like, yeah, I was hungry in the beginning. But then I noticed, I was really productive on those times I was fasting. I just felt more. You know who? Mind Pump.
Oh yeah. Mind
Pump.
Yeah.
What's his name? Sal, the main guy. He's a big time faster. I think he even fasts for like 3 days a month, some crazy shit like that. Like, or at least he was in the summertime. That's when I remember hearing him talk about the most. But he's really, and he says stuff like that. So when you hear those comments and you read the thing about Alzheimer's, and then you start to research, you say there's probably definitely something to that. So I think both those things, what you said, I agree with. I mean,
who benefits the most from intermittent fasting?
Fucking old people,
fatties.
Oh yeah,
fatties, obese people. They are the prime candidate for intermittent fasting because they have so much energy reserve.
Definitely.
That when they start, and they're not being bogged down by high blood sugars and high insulin environments, So right away they're tapping into their own body fat stores for energy. They're going to feel better. They're going to think better, because they've got so much energy packed onto their body everywhere.
Right.
Yeah. For people that are typically a lot leaner, like most bodybuilders, intermittent fasting can be a detriment. It depends how long you're doing it,
And the second part of the question, like you said, the GH part, that's just physiologic. That makes sense.
Yeah, that's all biochemical right there.
You got low insulin, you're going to have higher GH, for the most part, so and that's, kind of what happens with fasting. You wake up, you don't eat, your GH stays up as long as you,
it all makes perfect sense. Like what does HGH do? It helps your body to force yourself to use your own body fat for fuel, free fatty acids, right? That's one of the many properties of what HGH does. So when you're talking about like a obese person that's doing intermittent fasting and they start to feel better, after about 7 days, they got to get over the hump of not being able to eat fucking Wendy's and Dunkin' Donuts, right?
And just feeling that hunger that will go away.
It'll go away because they start dipping into their own body fat, their own, fuel sources. How are they dipping into their own fuel sources? Well, biochemically. All those, the right endocrine system, the elevated HGH, probably elevated thyroid hormones too as a result. There's a lot of things cascading to help free that energy up. You know what I mean?
Yeah. So I don't know who Mona Vand is, but I mean I think she's telling some truth. Right?
Yeah, I think
she's not writing some voodoo.
Yeah. And I don't think it just extends to Alzheimer's only. I think it definitely
there's a ton of other stuff out there.
Yeah. I think that is just one small facet that positively affects Alzheimer's or the delay of Alzheimer's, but there's so much more that goes into that. Got a couple of questions here, Doc. The next question here, 2 updates needed. Then a question. He says, "How is Doc feeling since his illness?" Doc, pretty good, right?
Oh yeah, except for that whole blood pressure weirdness, I'm not sure about yet. I feel great. I'm totally back to normal. I mean, I feel fine. I'm like perfect. Yeah. Except I don't have abs and I eat too much. But other than that,
you can just intermittent fast. You'll be fine. Right?
Nah. I need to eat.
I got one more thing about the intermittent fasting thing because it's like a soapbox for me. There's you remember how we were talking earlier about getting that pump in the gym and finding that point of diminishing returns?
Yeah.
There's a point of diminishing returns with fasting too, especially the leaner that you are and the more muscle that you carry. Because if you carry a lot of muscle and not that much body fat relatively, like proportionately, ratio-wise, your point of drop-off is going to be, you have to watch it. Like you can't, there's a point where you fast too long, your body will go into like a revolt and go back into like a hoarding mode because of your fat. Because look, the human body wants to be fat. Let's just, the human body is developed in such a way that
it wants, Patrick Ogden's human body
wants to store body fat because that's what helps us with survival, right? That's like an evolutionary adaptation. So with someone that is not super fat and carries a lot of muscle, already you're going against the evolutionary grain, right? You're not supposed to have a ton of muscle as a human. That's just something that we like to do to look good or whatever. But, so once you've gotten to that certain point when you're fasting, there could be a tipping point to where your body starts revolting and goes into hoarding mode. And when I'm talking about hoarding mode, you're talking about forced body fat levels and stuff. You know what I mean? So it's there's a drop off there. I experienced it myself. Of course, I was only eating once a day, and and it was usually a huge McDonald's meal. So it all depends calorically also. But you got to watch it when you are leaner with that intermittent fasting because you can get fatter on it. Believe it or not.
Oh, okay, yeah. Cool.
This next question that he said, part of your update, I mean, we talked about this too, and he switched to lower fiber, less veggies, and Doc switched over to green beans, no broccoli, because it sucks and it makes you fart, Yep,
and I don't eat anything that comes out whole on the other side. I try to avoid that.
Yeah, no blueberries. No more blueberries for you. What is Vij's current GH protocol? I am still running 20 to 30 IUs a week, split up into 2 or 3 injections a week. So I do bolus injections still, and working out pretty good, man. I like it. I'm a big fan. It keeps. I got to watch the side effects. A lot of times I have to run some Novodex because sometimes the nips can start hurting with the GH.
Mm-hmm.
Yeah, really.
Oh boy.
But other than that, it's good.
What was it? Yeah.
Go ahead. You were going to say?
No. What was the next question?
Oh, he says, now the question. What is something that you've learned that most people aren't aware of? He says, an example for me was Vij explaining that peanuts are more inflammatory than almonds. Yes, correct. Different fatty acid. Shit. I guess we kind of talked about that earlier with the whole point of diminishing returns and the pump.
Yeah, that's what I was thinking. People are aware of it, but I guess people who listen to our show might be aware of it. But the mind muscle kind of connection, I wish I'd have learned that earlier. I guess. But for me, this question's tough. Not to sound weird, but I mean, as a doctor, I'm aware of lots of treatments for lots of illnesses that most people don't know.
Sure. Yeah, I'm trying to think of something just like something like an everyday thing.
Yeah,
And,
well,
man,
here's another one. I just said it. Most people probably don't know that patients with cystic fibrosis shit oil.
There you go. Yeah, and they come
ring.
dust, right?
Yeah. Yeah, so I mean that is a tough one. I was thinking of so many things, and my big thing we kind of touched on when we started talking earlier. I was like, that kind of leads into this question. We were talking about things we wish we would have known, kind of thing, or we were more aware of when we were younger. And that's the one thing for me is people are aware of it now, but maybe younger people or new people in the gym aren't as, you could make a whole lot more progress if you knew how to sort of get that connection and focused on it. But my other thing, like I said, was I started thinking of all the stuff I've learned in medicine. And I mean, I guess I would have to say that most people aren't aware of that, or else I wouldn't have a job.
Yeah, right. Yeah, very true. Something that I'm just ballparking. I'm just spitballing here.
Yeah, that's what it's for. Fun question.
But I mean, something that I've learned is that was not I wasn't aware of until many years into coaching was that there's a lot of people that are fat intolerant. I don't know what it is. I don't know what the digestive issues are. I don't know if it involves mucus production or what for these people. I'm one of them, but a lot of people are fat intolerant. You pull those fats out of someone's diets. A lot of these people's diets, and just like that, man, their bodies turn around. They can put on lean muscle. They their dietary fat was holding them back. It was keeping them fatter, keeping them waterlogged, not allowing them to grow. Yeah, that's something that I've become aware of, within the last 5-10 years. And man, it's that's something to be aware of for people that are dieting, the people that are stuck. And they're plateauing. They can't figure it out. Why can't I get leaner? And because a lot of the science out there is that you need fat. You got to have fat. You got to have fat in your diet. Yeah, you do, but not that much for some people, and a lot for some other people. It's not. The protein is the one thing that everybody needs as bodybuilders, Yeah,
that seems to be the constant, doesn't it?
Yeah. Whereas carbs or fats or carbs and fats are all subjective to the person.
Yep. I agree with that. Yeah. And there's some people who, like me, I have trouble for both. Like carbs make me fat and fat makes me fat if I eat, too much of it. And of course I was never, and we talked about this before, but I think it's the time I grew up in. I was never a fat adder, because when I grew up, it was all low fat. That's how you lose weight. Low fat.
Right.
For me, I was always a protein carb kind of guy. And then when it wasn't protein carbs anymore, it's protein veggies.
Bags of veggies.
And bags of them. Yeah. And my body responds to that, or at least it did.
Yeah.
But I'm also noticing, for me, this is something that I just noticed since I've gone through this little health scare, is the one carb that I've noticed I feel like absolutely does nothing to me, honestly, is sweet potatoes.
Yeah. I'm a huge fan.
I feel like they digest perfect. I don't see any great weight fluctuations when I eat them, and I'm talking about eating one every meal. And I've learned that more, because now I'm kind of to the point where I got to limit the vegetables. I got to eat something, right?
Mm-hmm.
So I've put back in sweet potatoes, and that's the one that I eat them and I digest in minutes, and then your stomach doesn't feel bloated. But that's just me. That's what I've noticed for my body. So it's, we're always learning, right? Learning about yourself, learning about things in the gym. And there's always something new you could do for yourself to make you better, and you might not be aware of. And like for me, this health thing that I just went through with the bowel obstruction made me realize that, hey, maybe I don't need to just eat vegetables and meat. Maybe I can do some sweet potatoes. It's not going to make me fatter. You know what I mean?
Mm-hmm.
But you learn, you get stuck in your ways until your stomach stops working.
Yeah, absolutely. You know what? And in that vein, here's something that people, something I've learned that most people aren't aware of, that if you put it in your body and it makes you fart uncontrollably, you don't need it in your body. You throw it away and get rid of it out of your body. You don't need it.
I'm starting to notice that too.
Yeah.
I agree. I've been more aware of that because
I've had clients and I've switched over their foods and I always ask them, how are your guts doing? Are you farting more? Because all this stuff is super important. There's a lot of people out there that are oatmeal intolerant. No matter what they do with their oatmeal for however long they eat it, it always gives them farts. It gives them indigestion. And you got to take that shit out, man. You got to learn to read that biofeedback and take that shit out because it's not helping you. I don't care if it's in every goddamn bodybuilding magazine. You know what I mean?
Yeah, no, I agree. That's something, that I look back and I always remember with the vegetables I know why I was doing it, but I always was gassy and bloated. And I'm just like, well, it's the vegetables. It'll, be away. It'll be gone when I wake up in the morning and start the process all over again. But, so yeah, you're right. Now I took them out and I have less problems. And, I never like to use canned vegetables. I just always felt like, fresh or at least steamed or, just better for you.
Yeah, but not the case, is it?
Yeah, in my case, I got to go with the soft, mushy, even like probably should buy some Gerber baby food vegetables.
Dude, believe it or not, I dieted on a lot of baby food before, and it worked beautifully. I've used sweet potato baby food for many preps and it worked perfectly because they're like the bigger cans of it, the bigger bottles of it. That's like, I think it had like 35 grams of carbs. It was just perfect for a meal, So, and it digests beautifully. No gas, no nothing. Yeah.
B, you there?
Yeah, there you are.
Yeah.
Did you hit the mute by mistake?
I did. Sitting in this bed, I'm all awkward and shit.
We've got one more question, Doc, and we can hang it up here. Hey, Docs, I've long been a proponent of smoking weed pre-workout. My man, I find that a heavy sativa really turns me into the workout mentality. Gives me an incredible mind-muscle connection. Provides a really good pump. Dude, he's speaking my language. I was hoping you guys could explain this phenomenon to me because most people look at me like I have a dick growing out of my forehead when I say that my pre-workout consists of coffee and weed. Additionally, I wanted to thank you, Doc Puri, that's me, dropping pre-workout carbs and throwing in a tablespoon of almond butter to replace them was a fantastic suggestion. Boom. I've gotten fat, and I mean fat. The only part of me that grows with carbs in my muffin top, that grows with carbs in me is my muffin top. Every time I bump up above 100 grams of carbs a day, and you took some of the mystery out of that for me. So that's good. So he realizes he's pretty carbohydrate intolerant, right? And it's good.
Just to give you a refresher of your memory, this was the guy that talked about he tried the Captain Crunch pre-workout and he just never got pumps of it. And you said, you know what? You're fucking carb intolerant. Try to do some fats, and I bet you notice a difference.
Yep.
And so I guess he listened and tried that, and it sounds like you gave him a good suggestion.
Boom.
Good on you, Dr. Puri.
Yeah. Believe it or not, I am a doctor sometimes,
Yeah. Yeah. And I don't know what he's talking about with the weed thing, so that's out of my medical jurisdiction.
Honestly, I don't have a scientific explanation for it because this doesn't happen to everybody at all. This is super subjective. Again, it's everyone's. It's how the THC binds to some of the neurons in your brain, essentially. And there's scientifically an endocannabinoid system in everybody's body. Some lack it, some flourish, some, are completely middle ground. It's literally all over the place. I'm a lot like this person right here in that I find that weed pre-workout for me helps me to zone in. It helps me to weed out any, no pun intended, weed out any distractions that are going on in my brain so that I can focus only on the training and only on the muscle belly. And I think it has a lot to do with just marijuana. Or cannabis has an ability to just kind of relax anxiety. Overall anxiety goes way down, and when that happens, naturally you can focus on things a lot better. Some people don't have anxiety, and then when they take it, it's just a downer for them, and all they can do is have fucking couch lock and eat Cheetos, which that's great too.
Over my life, talking to people who use marijuana and stuff, patients, and even people I grew up with, obviously, right? I mean, I was born in the city. Like I grew up.
You're a fucking child of the 70s, man. Come on.
So I don't know why that happens, but that's a lot of people who, I know that who are chronic weed smokers over their life. A lot of them say it just helps them be more focused, zoned in. They can focus better. And then you have other people that just wig out and feel paranoid and fucking hate it, right? So who knows why that happens, but I don't know the scientific mechanism of why it happens, but I know it's definitely, like, for some people, that's what it does. It's that kind of effect. That's just like you think of Adderall, right? Not the same thing, but with ADHD kids, right? It's a stimulant. You take a bouncing off the wall ADHD kid that by all visuals doesn't need more stimulant, right? You're thinking this kid needs to be on a tranquilizer. You give him some Adderall and boom, he's the kid in the class doing his homework, sitting still, best case scenario, right?
Sure.
Goes from an F student to a student.
Yeah.
You give that same drug to a normal college person, somebody who's using it as a recreational, and they may take it and feel like euphoric and energetic, like they did some cocaine, or whatever, like a stimulant would for a person who doesn't have ADD. So I don't know if it's the same sort of phenomenon with. I think
it's real similar. I mean, just like you're saying, the analogy
is kind of similar. There's going to be some people whose brain, when they use the cannabis, it triggers whatever to focus, clarity, calmness. As opposed to you give it to a really paranoid, hyper crazy person, and maybe they're going to just turn into a nut, think they're having a heart attack because their heart starts racing fast. They're just, or like you said, turn into a couch potato and eat chips and not want to move and lose all motivation. So I don't know why that happens, but that just goes to show with everything we do, including putting on muscle, genetics play a fucking role in everything.
Mm-hmm.
And whether it's drinking alcohol, smoking weed, eating protein, fats, carbs, steroids, testosterone, you got, in our world, people think, everyone, when you first start lifting, you look up like Ronnie and you're like, oh, I'm going to be like that. And then you get to where we're at and you're like, yeah, there's nothing you can take to make you like that. Nothing, that's just genetic, right? So
yep, man.
I think the same thing goes with something like this. That's just my thought. I mean, I don't have a lot of experience, obviously, but I think I've heard many people say that, including you.
Mm-hmm. Yeah. Yep. I mean, from the people that I've talked to in the cannabis communities, even among them, it is a 50-50 deal. You know what I mean? There's some people that cannot function at all with cannabis. They'll take it and then they're done. They're done for the day. They're you know what I mean?
Yeah.
It's like they're just completely burnt out feeling, and they just they couch locked done. And the other 50%, man, they can focus. They can do better. They can thrive in that environment. In doing the things that they do. So I mean, geez, I can't say one way or another if a person should do it or not. I think for me, it's a great idea. For this listener here, it's a great idea. It's not always a great idea for everybody. Just gotta try. You have to try it out, man. You gotta try it out.
Try it out.
Yeah, you gotta try it out. See how it goes for you. Yeah, everyone's so different. Just like Captain Crunch works great for you and I pre-workout, not for this guy. You know what I mean? Same thing. Yeah. There's no difference. It's all the same. You gotta pick your poisons and roll with it, man. Learn your body. You gotta learn your body all the time. Yeah, constantly. Yeah. Your body evolves constantly. Trust me. I'm 40. Just turned 40. And shit gets weird, right?
You said that on Facebook the other night, and I'm like, wait till you're fucking 46.
Oh, gosh. It gets worse.
It's really weird.
Oh, man.
So yeah, just keep stop your timing right, your aging right now.
If I wish I could, man, I wish I could. No, but hey, you're gonna roll with it. What are you gonna do? That's it for the questions this week, Doc. What you got going on?
Oh man, busy day. I'm glad I got to get this in with you, though, man. Missed you, miss talking to you,
Me too.
Miss just chilling for getting some laughs in for a while. It's like a relief,
Yeah. I always walk away from here feeling pretty good, and the rest of my day ends up pretty good too.
Me too. I got a bunch of shit to do.
Yeah, good.
I got to train.
Yeah,
so
me too.
I'm probably going to do that at some point. I might do it right after we hang up, or I might do it later. Christine just snuck her head in the door and said she's leaving. She has a client at 9:30. She's going to go train, and then she told me if I wanted to go to the gym now I can, but she's going to go later, so I don't know if I'm going to wait for her or not. But I got to go to the dump because I got to throw away this treadmill that they broke and I took apart. I got to throw away some tables and some TV stands that we're not going to do anything with.
House stuff. Got a bunch of house stuff to do.
I'm sleeping on a mattress right now because Christine sold our bedroom suit while I was at work 2 nights ago. Came home, everything was gone. The dressers, the fucking mirror, the fucking bed.
It's so funny, man. Your wife and my wife have a lot in common, like a lot in common. The same way. I'll come home and there'll be like four pieces of furniture sitting in the garage. I'm like, what are those doing there? She's like, oh, I sold them. I'm like, oh, they're coming to pick them up here in a minute. I'm like, wow, that's cool.
And I'm like, so does this mean we're buying a new bedroom suit too?
Yeah.
She's like, yep. It'll be, and she's trying to, she wants to make it positive. So she's like, well, they'll have less stuff to move for the mover. It'll be faster. So then actually we went out 2 days ago and we bought all new furniture, living room furniture for the new basement and a new bedroom suit.
Well, yeah, and it's all got to match, it's all got to look. It has to look. It's got to reflect the great new house. You know what I mean?
Yeah, you saw the pictures. Our other, and you know what my other house looked like too. So the style completely different.
Style's different. It's just more modern. More modern.
That's what it is. Yeah.
It's a beautiful place, Doc. Congratulations again. I'm glad all this turmoil is closing, coming to an end.
Yeah, we actually funny thing is, right when I hang up here, one of the things I have to do is call the lawyer's office, and I have to go to the bank today and wire over the settlement money because they want it there wired. I guess we can't write a check or whatever. I don't know. Maybe they're afraid the check will bounce.
Yeah. You have to wire it. You can't be writing check. One day I'm just going to bring a briefcase full of cash and be like, take it.
Yeah,
what are you gonna do?
They'll be shitting their pants. You roll up there with fucking a couple $100,000 and just fucking throw it on the table.
Yeah, boom, take it.
Yeah,
fuck off, leave me alone.
And then my big highlight of the day, obviously talking to you, was the highlight of the day. Haley has a lacrosse game tonight.
That's right.
Against their crosstown rival high school, so she's pretty pumped for that one.
Cool.
They should be good.
All right, Doc, that's it for Clinical Muscle this week. We will be back intermittently. I can't promise when, but we will be back.
We'll definitely be back.
On that note, the doctors are out.
See you guys.